flat land.
Yeah, that's right.
Afghanistan, like this up, right?
Yeah.
So we hear drop the road, clearing people.
Yeah, right. Yeah. The 160 wouldn't do that.
Yeah, one thing like
160 wouldn't do that.
Sorry, telling you.
That's right. It's all flat. Don't put us in the ravine. Well, that's, I mean, those pilots. Sir, I think it's illegal. I'm probably sure.
HWI Subcommittee will come to order. Members, take your seats at the dais, please. Those in the audience, please have a seat or take your conversations outside. Good morning, all. Just to lay out kind of the procedure, how we're going to be moving this morning, we're going to be hearing almost exclusively subcommittee reports. There are only 2 bills on the full committee docket. There'll only be one that we may consider. More details on that in a moment. Being that we're just hearing subcommittee reports, these measures were all heard in subcommittee, had a full and thorough hearing at that time. We will not be opening up the dais for discussion or participation from the audience unless you have new information to offer on a matter or were unable to present at subcommittee. We also procedurally, there are 3 bills that I will request a motion to take by for the day. One is my House Bill 1450. The other 2 are 1917 and 2427. I would entertain a motion to go by for the day. All those in favor signify by saying aye. All opposed, nay. Those bills will go by for the Thursday docket. So speaking of Thursday, on Thursday, stay tuned for the actual meet time of the full committee, and this is going to be a surprise to Subcommittee 3 Chairman, but Subcommittee 3 will be meeting Thursday morning. Probably 7:30, maybe 8. We'll talk about that. There are not many measures that will still need to be heard in subcommittee, but because we need to be in a posture where that if they come to full committee, all bills in subcommittee 3 Thursday morning will appear on the full committee docket. However, with the caveat that only those bills with an affirmative recommendation from sub 3 will actually be heard at full committee. Thursday should be our last full committee meeting day before crossover. So anything that goes by on Thursday is bye-bye for the 2023 session. At the request of the patron, I would entertain a motion to strike House Bill 1799, and with the patron's consent on that and the assurance that I will work with him for writing a letter to try and address his concerns, he has proffered that motion if someone would make it. Do I hear a second? Moved, properly seconded to strike 1799. Please record your vote on the board on that motion. That bill is stricken from the docket, 17-0. I will also please ask committee members, remind you, if you need to speak, please use your request to speak button. That does help me immensely. And before we actually get into reports, Delegate Price, I believe you have some visitors here this morning.
Yes, Mr. Chairman. I would like to introduce to you all the emerging leaders from Newport News Public Schools. They are here to advocate on behalf of the things that they are passionate about. And this is, for some of them, their first time seeing a committee meeting. So we just want to welcome them and thank them for their advocacy.
And I presume that's them in the back. If they would wave, we'll wave back to them. Thank you for being with us this morning. I'm sure it's great to have a day off from school. Being a school teacher for 39 years, I always enjoyed being away from there. And so glad to have you. And just let you know, as you observe this subcommittee or this full committee, I try and set the bar low. So all the others probably work better than me. But that being said, any measures we need to discuss before I begin subcommittee report time? If not, Subcommittee 1.
Thank you, Mr. Chairman. Mr. Chairman, we have several bills before full committee. The first was Delegate Bell's bill, House Bill 1711, and that prohibits denial of parental access to the medical records of such parent's minor child unless federal law requires the minor child's consent. It was recommended to report 5-4, and I so move.
Do I hear a second? Seconded. Discussion from committee members on the motion to report House Bill 1711. Hearing none, members record your vote on the board on the motion to report. Have all members voted who care to be recorded? The measures reported.
Mr. Chair.
Hello.
Pardon me, my iPad is not in use.
Please record Delegate Hudson as a
Nay.
nay. All right, we've got that. Anyone else? As tech folks do their great thing. The bill is reported on a vote of 11 to 7. Delegate Edmonds.
Thank you, Mr. Chairman. Next, we had House Bill 1744, and there was a substitute. If council could report a substitute.
Mr. Chair, Delegate Edmonds, the substitute for 1744 rearranges some of the existing language. It includes all related approval documentation other than background checks under the definition for home studies. It specifies that transferability is at the request of the prospective foster parent, and it also takes some of the changes made in 63.2-1231 and moves those changes to 63.2-1734, which is the Regulations for Child Welfare Agencies statute. It also adjusts the enactment clause so that the bill no longer creates a work group.
And if the committee will note, I've asked staff to give us a brief description of the substitute so that we'll understand the changes that are made from the original legislation. The motion is to adopt the substitute without objection. We'll adopt that by general consensus. Hearing none, the substitute is properly before us. Delegate Edmonds.
Mr. Chairman, the substitute was recommended to report on a vote of 8 to 0, and I so move.
Discussion on the motion to report as a substitute. Hearing none, record your vote on the board.
Pardon me a second.
If all members voted who care to be recorded, the bill is reported 19 to nothing. Delegate Edmonds.
Mr. Chair, House Bill 1754, Delegate Head's bill, also had a substitute.
Mr. Chair, Delegate Edmonds, this removes the change to the in-person evaluation requirement, returning it to 1 year as opposed to 3. It also limits the exception for practitioners in the same subspecialty group to doctors of medicine, doctors of osteopathy, PAs, respiratory therapists, OTs, and nurse practitioners.
Without objection, we'll adopt the substitute. Hearing none, by general consensus, it's adopted.
And, Mr. Chairman, House Bill 1754 was recommended to report on a vote of 8 to 0 with 1 abstention, and I so move.
Second.
Have motion properly seconded. Discussion on the matter. Delegate Adams, you wish to?
Yes, Mr. Chair, I just had a question. The bill that we're going to be voting on did strike the 3 years and it's down to 1 year. Is that correct?
Mr. Chair, that's
That
correct.
is correct. Yeah.
Thank you, sir.
Further questions or discussion on the motion to report as a substitute? If not, members, record your vote on the board. If all members voted to care to be recorded, the bill reports on a vote of 18 to 1. Delegate Edmonds.
Okay, House Bill 1768, also Delegate Head's bill, was recommended to report and refer to appropriations. And it requires local departments of social services, when determined necessary by the local multidisciplinary team during the local department's investigation of a report of child abuse or neglect, to facilitate within 14 days an interview of the child by a child advocacy center that is recognized by the National Children's Alliance and located in the locality served by the local department. The bill allows, in cases which the investigation is being conducted in cooperation with a law enforcement agency, such interview to be conducted within 21 days. It was recommended to report and refer by a vote of 8 to 0, and I so move.
Move the substitute.
And I believe there were amendments. If you could tell
With
us.
amendments, I'm sorry, excuse me.
Mr. Chair, the amendment replaces the with a, so that the bill now reads, if a local multidisciplinary team, rather than if the local multidisciplinary team.
These grammarians. If there's no objection to the amendments, they'll be properly adopted by consensus. The bill is now properly before us with a recommendation to report and refer to appropriations.
Second.
Discussion on the motion. Record your vote, please. If all members voted to care to be recorded, the bill is reported and referred to appropriations 19 to nothing. Delegate Edmonds.
Mr. Chairman, House Bill 1814, Delegate Waxman's bill, removes dispensing of covered substances with a licensed narcotic maintenance treatment program from the list of circumstances exempt from reporting requirements of the prescription monitoring program. The bill has a delayed effective date of July 1, 2024. It was recommended to report from subcommittee on a vote of 9-0, and I so move.
Moved properly seconded to report House Bill 1814 as introduced. Discussion on the motion. Hearing none. Record your vote on the board. Please close the roll. The bill is reported 19-0. Delegate Edmonds.
House Bill 1817, Delegate Avoli's bill, permits seizure of a decedent's non-probate assets to cover the cost of disposition of such decedent's unclaimed body. Currently, seizure is limited to estate assets out of which disposition costs may be paid. It was recommended to report on a vote of 6-1, and I so move.
Moved properly seconded to report House Bill 1817. Discussion on the motion. Record your vote. All members voted. That measure is reported 18-1. You're on a roll.
Okay, House Bill 1946, Delegate Waxman's bill, provides in the criteria for licensure as a behavior analyst or assistant behavior analyst established by the Board of Medicine that certain documentation must be provided by the Behavior Analyst Certification Board or its successor. Under current law, such documentation must be provided by the Behavior Analyst Certification Board or any other entity that is nationally accredited to certify practitioners of behavior analysis. It was recommended to report from subcommittee on a vote of 9-0, and I so move.
Do we hear a second? Second. Moved properly seconded to report 1946. Discussion on that motion. Please record your vote on the board. Roll is closed. The bill reports 19-0. Delegate Edmonds.
House Bill 2146, Delegate Guzman's bill, directs the Virginia Board of Social Work to adopt reciprocity standards for licensed clinical social worker candidates who meet certain criteria and are licensed in another state. The bill directs the Board of Social Work to develop and adopt application criteria and procedures for LCSW licensure by endorsement and to provide the reciprocity standards and application criteria and procedures to the Virginia Department of Health Professions by October 1, 2023. The bill was recommended to report from subcommittee on a vote of 9-0, and I so move.
And I believe we have a substitute if staff could tell us the difference.
Thank you, Mr. Chairman.
Mr. Chair, the substitute changes the original bill into a work group to examine the feasibility of the Board of Social Work adopting licensure by reciprocity.
So it's now a Section 1 measure. All right.
Mr. Chair, yes.
Questions on the adoption of the substitute? Any objection? Hearing none, the bill is amended by substitute by general consensus. And the recommendation was to report as a substitute. I heard a second. Please vote on that matter. Please close the roll. The bill reports 19-0.
Mr. Chairman, House Bill 2147 also was a substitute.
Mr. Chair, the substitute here also changes the original bill into a work group, this time to evaluate the viability of requiring the provision of translated directions for the use of prescriptions.
Mr. Chairman, the substitute was recommended to report on a vote of 9-0, and I so move.
And without objection, we'll adopt the substitute from the subcommittee. Hearing none is properly adopted, and the motion is to report as a substitute. Did I hear a second? I did. Please record your vote on the board on the motion to report as a substitute. I'm trying, Mr. Chairman. It's not taking me. I'm in aye. All members having voted that care to be recorded, the bill is reported 20-0. Delegate Edmonds.
House Bill 2157, Delegate Ferris's bill, provides that when an interjurisdictional compact requires criminal history record checks as a condition of participation, the applicable health regulatory board shall require each applicant to submit to fingerprinting and provide personal descriptive information to be forwarded along with his fingerprints through the Central Criminal Records Exchange to the Federal Bureau of Investigation for the purpose of obtaining criminal history record information. It was recommended to report and refer to appropriations on a vote of 9-0, and I so move.
The motion is to report and refer to appropriations as introduced, House Bill 2157. Discussion on the motion. Hearing none, record your vote on the board on that matter.
Mr. Chairman, I vote aye. There we go. Okay.
Close the roll. The bill is reported 20-0. Delegate Edmonds.
House Bill 2306, Delegate Freitas bill, exempts a person, including a parent or guardian, on behalf of a child who objects to administration of a vaccine on religious grounds from mandatory immunization requirements issued by the Commissioner of Health during an epidemic. Currently, exemption from mandatory immunization requirements during an epidemic is available only to those persons to whose health the administration of the vaccine would be detrimental, as certified in writing by a licensed physician. Mr. Chairman, there was considerable discussion, but it was, at the end, recommended to report by subcommittee on a vote of 5-4, and I so move.
And could staff tell us, I believe there's an amendment on this matter?
Mr. Chair, this amendment replaces an "and" with an "or," so that the statute applies to persons whose health could be detrimentally affected by a vaccine or persons with a religious belief that conflicts with the administration of the vaccine.
If no objection to the amendment, it's properly attached, and the recommendation was to report as amended 5-4. Discussion on that motion. Hearing none, record your vote on the board on the question to report 2306. Have all members voted who care to be recorded? The bill is reported 12-8. Delegate Edmonds.
House Bill 2359, Delegate Ferris's bill, also had amendments.
Staff, whenever you're ready, to tell us what the amendments do different. Or the patron.
Yes, sir.
Delegate Ferris.
There was, Mr. Chairman, there was amendments to this. It was amendments that dealt with acupuncture, and that is something that the physical therapists tell me they do not practice, and they are okay if the staff wants to read that amendment.
Yes, Mr. Chair, this specifies the requirement for compliance with dry needling provisions. It specifies that PTs can provide services without referral to infants and toddlers as part of their individualized services plans.
And it does, I believe, stipulate they cannot hold themselves out to be acupuncturists. Is that correct? Or
I would have to double check that.
is that part of it, Delegate Freitas? No, Delegate Ferris, excuse me.
Yes, sir, Mr. Chairman.
Okay. Y'all heard the amendments. Without objection, we'll adopt them by general consensus. The amendments are properly attached. And then the recommendation was to report 9-0. Discussion on that motion. Please record your vote on the board on the motion to report as amended. If all members voted who care to be recorded, the bill is reported on a vote of 18-1. Delegate Edmonds, I believe you have one more.
That one was House Bill 2437 was the bill we heard this morning. And
Then that will not be before us.
yeah, that's what I was thinking.
Okay.
So.
And just for the audience knowledge, there were measures heard in Sub 1 this morning. They were not put on the docket for today. I think this was because the intention was it needed to go upstairs. But to let everybody know, in communication with appropriations staff, they have monitored the activities of the subcommittee this morning, and they will be anticipating these measures coming up on Thursday. And so it puts the bills in no danger by letting them be heard on Thursday, where there's the proper 24-hour notice to the public of what's going to be coming up. So thank you, Delegate Edmonds. Good work. Subcommittee 2, I believe that's Delegate Hodges.
Thank you, Mr. Chairman, and thank the members of the subcommittee. We had a busy day. First bill, House Bill 1426, Delegate Tata, and there was a substitute. Mr. Chairman, I would move the substitute.
All right, staff.
Yes, Mr. Chairman. The substitute directs that as a part of the continuing learning requirement Any licensee of the Board of Medicine may be required to complete continuing education as a required subject area, and if the Board of Medicine does pick a specific subject area, the first topic will be human trafficking.
Without objection, we'll adopt the substitute by general consensus. Hearing none, it's properly adopted. Delegate Hodges.
Thank you, Mr. Chairman. The substitute was reported 10-0, and I so move.
Do we hear a second? Second. Discussion on the motion to report as a substitute. Hearing none, please record your vote on the board. Measure is reported on a vote of 20-0. Delegate Hodges.
Thank you, Mr. Chairman. House Bill 1525, Delegate Corner, permits the Department of Behavioral Health and Developmental Services, direct care service providers, and community boards to hire peer recovery specialists who have been convicted of certain barrier crimes where a history of such offense does not pose a risk in the work of peer recovery specialists. The substitute was reported 10-0 and referred to appropriations.
And staff explain the changes, please.
Yes, Mr. Chair. So this essentially it brings the peer recovery specialist exceptions under subsection C, which already has existing exceptions for people who are working in adult mental health treatment facilities and adult substance abuse programs, treatment programs. And so the only exception that applies additionally to peer recovery specialists is exemption from felony possession. And then it also reinstated language that required the use of a screening contractor and made a small change where instead of report being replaced with record, it says report or record so that the state police have the discretion to either issue a report or a record.
If there are no objections or questions on the substitute, we'll adopt it by general consensus. It's properly before us, and the recommendation from the subcommittee is to report and refer to appropriations 10-0. On that motion, please record your vote on the board. Record Delegate Bell is affirmative. There we go. Okay. The measure is reported on a vote of 19-1. Ferris is a yes. 20-0. Anyone else? All right. Reported 20-0. Delegate Hodges.
All right. House Bill 1891, Delegate McGuire, requires the Department of Behavioral Health and Developmental Services to establish a pilot program to make electroencephalogram combined transcranial magnetic stimulation available for veterans, first responders, and law enforcement officers. The bill requires the State Board of Behavioral Health and Developmental Services to establish regulations for the pilot program. It was reported and referred to appropriations 10-0, Mr. Chairman, and I so move.
Do we hear a second? Second. Members have heard the motion to report and refer to appropriations. Discussion on the motion? Hearing none, please record your vote. Delegate Ferris, you still want to be a no this time? Yes. Okay. All right. The bill is reported and referred 19-1. You just don't want to see these upstairs.
Mr. Chairman, I don't want people to think I'm voting no. I just do not want to appear that I'm in favor of something that might have more consequences and appropriations than I.
Well, my lessons learned. I won't say anything about Delegate Ferris anymore. So go right ahead, Delegate Hodge.
All right. I can't. House Bill 1919, Delegate Williams-Graves, provides that if a person confined in a state correctional facility is pregnant, gives birth during such confinement, is enrolled in the state plan for medical assistance, and would otherwise be eligible for coverage under the state plan for medical assistance for a 24-hour inpatient stay at a medical institution, but for the fact that such person's stay was less than 24 hours, the cost of such person's birth shall be covered by state funds. The bill directs the Department of Medical Assistance Services to, and in coordination with the Department of Corrections, identify persons confined in state correctional facilities who are enrolled in or may be eligible for services under the state plan for medical assistance and provide information to such persons regarding any steps necessary to obtain coverage for childbirth prior to the person's release on medical furlough for the purpose of giving birth. It was reported with a substitute, Mr. Chairman, and referred to appropriations 9-0.
And staff, if you could tell us the differences with the substitute.
Thank you, Mr. Chairman. The substitute directs DMAS and the Department of Corrections to try and identify people confined in state corrections who are pregnant and may be eligible for Medicaid and give them information needed to obtain Medicaid coverage before they are released to give birth or receive pregnancy-related care. So the big difference is they have to try and identify.
No questions on the amendment adopted by general consensus. It's properly adopted, and the recommendation was to report and refer to appropriates 9-0. Questions on the motion? Please record your vote on the board. Have all members voted who care to be recorded? The bill is reported and referred 18-1. Delegate Hodges.
All right. House Bill 1952, which was my bill, requires that a pharmacy that, on average, during any 1 week period is unable to process a prescription within 2 days of receipt of such prescription shall report the prescription backlog to the Board of Pharmacy. The bill requires any pharmacy making such report to submit a corrective action plan detailing its staffing, workflow technology, and patient communication strategies to address the prescription backlog. The bill permits the board to investigate any reported or suspected backlog, accept, amend, or reject a corrective action plan, and impose disciplinary action against the pharmacy permit for failure to comply with this section. Additionally, the bill allows pharmacies to perform centralized or remote processing of prescriptions in accordance with regulations promulgated by the board. The bill directs the board to adopt emergency regulations within 280 days of enactment. It was reported 9-0, and I so move.
Delegate Waxman, you had questions or comments?
I did have a question for the committee chair. How does that handle for a pharmacy that may not be open on weekends and is a 2-day lapse when they're not open?
It would go into their 7-day average. I mean, that's, if they're not open weekend, whatever they would do on that 7-day.
Thank you.
Further questions or discussion on the motion to report 1952? If not, record your vote on the board. Have all members voted who care to be recorded? The bill is reported on a vote of 18-1. Roll on.
All right. House Bill 2008, Delegate Adams directs the Department of Health to convene a work group to study and make recommendations for reducing the occurrence and impact of tick-borne diseases in the Commonwealth. The work group shall report its findings and recommendations to the Governor and the General Assembly by November 1st, 2023. It was reported 9-0, and I so move.
Do we hear a second? You've heard the motion before the committee to report House Bill 2008. Discussion on the motion? If not, record your vote on the board. If all members voted who care to be recorded, the bill is reported on a vote of 20-0. Delegate Hodges.
Thank you, Mr. Chairman. House Bill 2025, Delegate Rome, requires the Department of Social Services to develop, annually update, and provide to each school board in advance of the start of each school year an information sheet on the SNAP benefits program that sets forth the application process and such other information as the department deems necessary or appropriate in order to properly inform the parents of students enrolled in public elementary and secondary schools of such program and encourage application by those who are eligible. The bill requires each school board to ensure that such information sheet is sent home with each student enrolled in a public elementary or secondary school in the local school division at the beginning of each school year, or in the case of any student who enrolls after the beginning of the school year, as soon as practicable after enrollment. The bill also requires each school board to ensure that a fillable, free, or reduced price meals application is sent home with each such student at the beginning of each school year, or in the case of any student who enrolls after the beginning of the school year, as soon as practicable after enrollment. The bill reported 10-0, Mr. Chairman, and I so move.
It's been moved and properly seconded for all of you who are sleeping that we report this bill. Discussion on the motion to report 2025. Record your vote on the board. Some of these Some of these summaries are longer than the bills themselves. But have all members voted who care to be recorded? Delegate Ferris? Somebody nudge him. The bill is reported on a vote of 16-2. Delegate Hodges.
All right, Mr. Chairman, House Bill 2055, Delegate Glass, directs the Chief Medical Examiner to pay into a special fund any amount of surplus payroll funds that will remain unspent at the end of each quarter of each fiscal year. The bill defines surplus payroll funds as payroll funds appropriated to the Office for Salaries and Compensation that at the end of each quarter of each fiscal year will remain unspent due to personal vacancies. Such funds are to be deposited in the Medical Examiner Compensation Fund created by the bill to be used to make technological upgrades or provide temporary pay, recruitment or retention bonuses, or overtime pay of office personnel. The bill requires the Chief Medical Examiner to establish a written policy for making disbursements from the fund and for the State Health Commissioner to approve the policy. The bill was reported and referred to appropriations 7-1 to 1, Mr. Chairman, and I so move.
Discussion on the motion to report and refer to appropriations 2055. Record your vote on the board on that motion.
Mr. Chairman, I record as an aye. There we go.
All members voted who care to be recorded. The bill is reported and referred to appropriations 16-3. Delegate Hodges.
All right, House Bill 2139, Delegate Delaney, allows pharmacists to refill prescriptions for insulin without authorization from the prescriber in emergencies. It was reported 10-0 with substitute, Mr. Chairman.
Staff?
Thank you, Mr. Chairman. The substitute adds including insulin to the existing language that allows a prescription for a drug controlled by Schedule 6 to be refilled without authorization under certain circumstances, and authorizes a pharmacist to refill a prescription when they only have access to the prescription label.
Without objection, we'll adopt the substitute. It is properly adopted, and the recommendation is to report 10-0 as amended. Properly seconded. Discussion on the motion? If not, record your vote, please. Bill is reported on a vote of 19-0. Delegate Hodges.
All right, thank you, Mr. Chairman. House Bill 2192 directs the Department of Behavioral Health and Developmental Services to transform Catawba Hospital into a state-of-the-art facility at which a continuum of substance abuse treatment and recovery services is provided in addition to the array of behavioral health and other services currently provided to geriatric individuals in need of mental health care. It was reported and referred to appropriations 9-0, and I so move.
Do we hear a second? Moved properly seconded to report 2192 without amendment and refer to appropriations. Please record your vote on that matter. Delegate, there we go. Bill is reported and referred to approps 19-0. Delegate Hodges.
All right, House Bill 2255, this was my bill, Mr. Chairman, modifies the requirements for inspections of services provided by licensed provider of behavioral health and developmental services. The bill removes the requirement that an inspection is conducted annually and replaces it with a requirement that an inspection is conducted at least once during the licensing period. The bill removes an evaluation of physical facilities where services are provided from the inspection requirements. There was a substitute that was reported 10-0, Mr. Chairman.
Staff, are you care to tell us what the substitute difference is?
Mr. Chairman, the substitute is a Section 1 bill that directs the Department of Behavioral Health and Developmental Services to review its regulations and consider adjustments to the frequency of licensing inspections.
Without objection, we'll adopt the substitute. It's properly adopted. And the recommendation is to report as a substitute. Discussion on the motion. Delegate Ferris. All right. Please record your vote on the board on the motion to report as a substitute. Measures reported, 19 to nothing. Delegate Hodges.
Okay, House Bill 2342 separates, it was Delegate Campbell, separates background check requirements for direct care positions with service providers and community boards. The bill separates provisions regarding background checks of employees in direct care positions providing adult substance abuse and mental health services from those of background checks of employees in direct care positions providing services for children and developmental services. It was reported 10 to 0, Mr. Chairman, and I so move.
Moved properly seconded to report 2342. Discussion on the motion? If not, record your vote on the motion to report. The bill is reported, 19 to nothing. Delegate Hodges.
Okay, House Bill 2344, Delegate Head, removes the requirement that the Adult Protective Services Hotline immediately refer certain reports of alleged adult abuse, neglect, or exploitation to the appropriate local law enforcement agency, and removes the duty of local law enforcement agencies to provide the Adult Protective Services Hotline with a preferred point of contact for such referrals. The bill retains the requirement for the local Department of Social Services to immediately refer such reports to the appropriate local law enforcement agency, and the duty of local law enforcement agencies to provide local departments of social services with a preferred point of contact for such referrals. It was reported 10 to 0, Mr. Chairman, and I so move.
Do I hear a second? Discussion on the motion to report 2344. Hearing none, record your vote on the board. The bill is reported on a vote of 15 to 4. Continue, please.
Okay, House Bill 2345, Delegate Head, renames the Emergency Department Care Coordination Program as the Smart Chart Network Program and expands the program to allow participation by all healthcare providers, insurance carriers, and other organizations with a treatment payment or operations relationship with a patient in the Commonwealth under current law. Participation is limited to hospital emergency departments. The bill makes several other modifications to the program, including adding the requirement that the program allow healthcare providers, insurance carriers, and other participating organizations to access information necessary to evaluate and monitor the care and treatment of a patient in accordance with applicable patient privacy and security requirements. The bill also directs the State Health Commissioner to convene a work group to study and establish a plan to develop and implement a system to share information regarding a patient's prescription history. The bill requires the Commissioner to report his findings and recommendations to the Chair of the Joint Commission on Healthcare, Senate Committee on Education and Health, House Committee on Health, Welfare, and Institutions by October 1st, 2023. It was reported with amendment 10 to 0 to refer to appropriations, Mr. Chairman.
An explanation of the amendments from the subcommittee, please.
The substitute adds language related to methods to continue improving care coordination in hospital emergency rooms and reducing frequency of people who visit emergency rooms regularly. It also adds a provision that the advisory council will ensure information is shared with the appropriate entities, and it renames the Emergency Department Care Coordination Advisory Council as the Smart Chart Network Program Advisory Council. It also adds an effective date of July 1st, 2024.
Questions on the amendments? Hearing no objection, we'll adopt them by general consensus. Delegate Head.
Thank you, Mr. Chairman. There is an additional line amendment that we need to propose. I think the clerk has that. I can tell it, or council can.
This additional amendment adds a private sector technology expert with experience in prescription drug sharing and controlled substance monitoring to the work group that's in one of the enactment clauses.
Heard a motion to adopt the amendment. Do we hear a second? Without objection, we'll adopt it by general consensus. The measure is now further amended. And I believe with the original in that amendment, the recommendation was to report and refer to appropriations 10 to nothing. Do I hear a second to that? Please record your vote on the board if there's no discussion on that motion. If all members voted to care to be recorded, the bill is reported and referred to approps 17 to 1. Delegate Hodges.
All right, House Bill 2380, Delegate Rome, directs the Department of Social Services to provide information, resources, and education to food banks regarding providing assistance to individuals completing a SNAP application, including the process for organizations to enter into a contract with the department to provide this service. It was reported 8-0, Mr. Chairman, and I so move.
Delegate Price, you have, oops, one away. All right, questions on the motion to report 2380? Hearing none, record your vote on that motion. All members care to be recorded having voted. The bill is reported on a vote of 18-1. Delegate Hodges.
Okay, House Bill 2427, Delegate Freitas, allows patients to bring an action against the hospital that is not material compliance with hospital price transparency laws.
I'm sorry, that measure went by for the day.
I'm sorry, Mr. Chairman.
Oh, my bad, 2465 then.
My bad, so should have marked that off. House Bill 2465 is actually my bill, and it permits prescription drugs in full or partial containers to be returned up to 6 months after the labeled expiration date for full credit or replacement. Mr. Chairman, I do have a friendly amendment that I'd like to offer that may clear up some questions that were in subcommittee.
You or staff have that?
Staff, they actually have that.
Mr. Chair, this is on line 37. After B, strike the remainder of line 37 and insert removed from pharmacy shelves and returned to the manufacturer.
And I don't think we need to distribute that, but if you could tell us how the significance of that change.
Thank you, Mr. Chairman. This just clarifies, it makes it clear that the inventory is removed from the pharmacy shelves to be returned to the manufacturer. I think there was some concern maybe going back through the wholesalers or patients bringing those medications to the pharmacy. So this just clarifies that.
Questions on the
from
proposed
DHP.
amendment? If there's no objection, we'll adopt it by general consensus as properly amended. And the recommendation was to report the matter on a vote of 6-4. Discussion on that motion? Please record your vote on the motion to report. Delegate Hodges, I think your amendment fixed the bill, and it's reported on a vote of 19-0.
Thank you, Mr. Chairman.
Delegate Head, you had a motion, I believe?
Yes, Mr. Chair, having voted on the prevailing side whereby we reported House Bill 2344, I would like to move we reconsider that vote so that a member can change their vote.
Do we hear a second?
Second.
All those in favor of reconsidering House Bill 2344 signify by saying aye. Aye. All opposed, no. It's properly back before us. In discussion on the motion to report, hearing none, record your vote on the board on that motion. If all members voted, care to be recorded, the bill is reported 17-2. And Delegate Hodges, I believe that completes your subcommittee report for today.
Yes, sir, Mr. Chairman. And if people want to sleep, if I may, Mr. Chairman, they can call me anytime, and I'll be glad to read to them.
You read bedtime stories.
So they
Got
can read
it.
bedtime
Okay.
stories, and hopefully that will help. Thank you, Mr. Chairman.
Delegate Walker. All right. Delegate Walker, you have a report?
Yes, sir, Mr. Chairman. So HB 1465, Delegate Kresick. This bill deals with problem gambling treatment and support advisory committee establishment. Department of Behavior Health Development Services program gambling treatment support advisory committee established.
Hold 1 second, Delegate Walker. Committee will go at ease for just a moment. Ken, go ahead, Delegate Walker. I'm sorry.
Okay. Back to HB 1465, Delegate Kresick. The Subcommittee recommended reporting 6-0, and I so move.
And this matter will need to go to appropriations, so do I hear a proper motion to report and refer to appropes? Been moved properly seconded. Discussion on the motion to report and refer to appropriations. Hearing none, please record your vote. All members voted declare to be recorded. The bill is reported on a vote of 19-0. Delegate Walker.
Next bill is HB 1624, Delegate Ballard, and this deals with the mental health and rehabilitative services for military service members transitioning to civilian life. Mr. Chairman, that's the committee recommended 4-0, and I so move.
Moved properly seconded to report 1624. Discussion on the motion? If not, please record your vote. If all members voted, declare to be recorded. Matter is reported on a vote of 19-0. Delegate Walker.
Next bill is HB 1689, and I do not have that in my book here. If the clerk has a copy of that, could read that, please.
And if staff could tell us there was a substitute offered on that, if you could tell us the differences in the substitute.
That's correct, there was a substitute.
HB 1689 was reported with the substitute 3-2. This requires hospitals, nursing homes, and certified nursing facilities to allow patients to receive visits from clergy members during a declared public health emergency related to a communicable disease, a public health threat. Under the bill, the hospital, nursing home, or certified nursing facility may require the clergy member to comply with all reasonable health and safety requirements and may restrict visits of clergy members who fail a health screening measure or test positive for a communicable disease of public health concern. If the health and safety requirement substantially burdens the clergy member's free exercise of religion, the hospital, nursing home, or certified nursing facility may require compliance only if the requirement furthers a compelling health and safety interest and imposes the least restrictive requirement. The bill provides immunity for hospitals, nursing homes, and certified nursing facilities and their employees and contractors from liability for injury or death due to exposure to a communicable disease of public health concern resulting from or related to such visitation, except in limited circumstances. The bill also allows a person or religious organization to bring a civil action against a hospital, nursing home, or certified nursing facility alleging a violation of such visitation provisions. And the
How did the substitute change it from what you just explained?
Thank you, Mr. Chairman. The substitute changes healthcare institutions to hospitals, nursing homes, or certified nursing facilities. It also changes the evidentiary standard from clear and convincing to a preponderance of the evidence, and it removes the civil action component.
So it narrowed the scope and removed the civil action in large measure. Questions on the substitute? Yes, sir.
Mr. Chairman, could the hospital representative answer a question for me?
Sure, as they're coming forward. They still don't like it.
You.
Mr. Chairman, Brett Rawlings, Virginia Hospital Healthcare Association.
Y'all still don't like it, right?
The chairman stole my thunder. So the changes in the substitute don't satisfy what your requirements?
Yes, I think our position is the provisions we had in law previously were sufficient to protect the interests of patients and staff, and we've struck the right balance there, and that provisions here further set forth possible conflicts with federal requirements, and we seek to avoid that.
Brent, would it be fair to say y'all don't like it quite as bad since the civil action piece was taken out of it?
Yes, Mr. Chairman, we don't like
Body
it
English
quite as
speaks volumes.
bad.
That was good. Okay.
Yeah, and
Yeah.
Yes, that is definitely an improvement.
Mr.
But
Chairman.
I prefer to not see the measure.
Yes, sir.
Just for the record, this, Mr. Rawlings, just for the record. So if we pass this and implemented it, we would be in violation of CMS rules.
Mr. Chairman, Delegate Sickles, I can't answer that affirmatively. I don't think there's a clear and direct conflict. It's just that we're putting in code certain prescriptions that, depending upon the circumstances and the nature of the disease and other guidance that's available, might conflict with that in the future. So can't answer that definitively.
So I think the answer was maybe. Okay. Other questions? Further discussion on adoption of the substitute? If there's no objection, we'll adopt the substitute by general consensus. As a substitute, the measure was recommended for reporting on a vote of 3-2. That motion is now before us. Discussion on the motion to report as amended, 1689. Hearing none, please record your vote. The bill is reported on a vote of 12-8. Delegate Walker.
Next bill is HB 1799. This is Delegate Frieda's bill.
That bill was stricken from the docket, patron's request.
I'm sorry, Mr. Chairman. Next bill is HB 1833, Delegate Walker. The Department of Professional Occupation Regulations, over-the-counter and prescription hearing aids. Sort of clarifies that the licensing for the Board of Hearing Aid Specialists and Opticians is not required for a corporation, partnership, trust, associations, and other organizations engaged in the business of selling prescription hearing aids, defined in the bill as hearing aids that is not over-the-counter hearing aid, provided that its employees only licensed practitioners in the direct sale and fitting of hearing aids. Mr. Chairman, that subcommittee recommended 4-0, and I so move.
And there was an amendment proposed, I believe, at subcommittee. If staff could explain that, please.
Mr. Chair, the amendment adds B. So the sentence now reads, nothing in this chapter shall be construed as requiring a licensee to engage in the business of selling over-the-counter hearing aids.
Discussion on the motion for the substitute, for the amendment. If no objection, is properly attached. Recommendation to his report, 4-0. That is the motion before the committee. Discussion on that motion. Hearing none, please record your vote. The bill is reported on a vote of 20-0. Delegate Walker.
Next bill is HB 1874, Delegate Helmer. Substitute Nutrition Assistance Program, Special Supplement Nutrition Program for Women, Infants, and Children applications. Prohibits the Board of Social Services from requiring persons applying to participate or renewing their participation in supplement nutrition assistance programs to appear in person. The bill also codifies the Department of Health's authority to implement special supplement nutrition programs for women, infants, and children, which is WIC, which is currently authorized by the regulations that prohibits the Department of Health from requiring persons applying to participate or renewing their participation in the WIC program to appear in person. Mr. Chairman, that recommendation was with an amendment, and it was 4-0, and I so move.
And if staff could explain the substitute difference.
Mr. Chair, this adds the phrase except as otherwise required by federal law or regulations to the bill. So individuals don't have to appear in person to apply for SNAP, except as otherwise required by federal law or regulations.
Questions on the substitute? Without objection, we'll adopt the substitute by general consensus. It's properly adopted. And the motion is to report as substitute. Discussion on that motion. Please record your vote on the motion to report as substitute. If all members voted, declare to be recorded. The bill is reported with substitute 19-1. Delegate Walker.
Next bill is HB 1900, Delegate Hope. Provisional licenses issued to providers of behavioral health and development services, notice requirement, waiver of appeal right by consent agreement. Requires the Commissioner of Behavioral Health and Development Services to notify a provider of behavioral health and development services who has issued a provisional license of any limitations that can be placed on the provider or any other agency of the Commonwealth, including the restrictions on reimbursement that may be imposed by the Department of Medical Assistance Services. The bill requires a consent agreement signed by the provider waiving the right to appeal and provision license insurance decisions outlining other potential restrictions on reimbursement, and a copy of the signed consent agreement be provided by the Department of Medical Services. That bill passed with an amendment, 5-0, and I so move.
Staff, explain the amendment, please.
Mr. Chair, the amendment changes the word commissioner to department. It also directs providers who are issued provisional licenses to review pertinent regulations and determine the limitations that may be placed on them. And it changes DMAS to other state agencies or payor sources.
Questions about the amendments? If there are no objections, we'll adopt them by general consensus. So adopted, and the recommendation is to report as amended. Second. Discussion on the motion? Please record your vote on that matter. All members voted. Care to be recorded? The bill is reported 19-0. Delegate Walker.
Next bill is HB 1904 by Delegate Hope. Emergency Department of Care Management Grant Program and Fund Report. Establishes Emergency Department of Care Management Grant Program and the Emergency Department Care Management Grant Fund. The bill provides that the program is established to provide grants eligible to hospitals that provide care management and medical services to frequent users of the hospital emergency departments, with grants to be awarded, number one, reduce patient usage of emergency department for routine, non-surgery, primary medical care, support emergency department case management staff, and the states of the Health Commissioner to report the department's findings to the General Assembly and the Joint Commission on Health Care by October 1 of 2027. Provision of this bill sunset or July 1, 2028. Mr. Chairman, the subcommittee recommends reporting with amendment and also recommends referring to the Committee on Appropriations by a 4-1 vote, sir.
Please tell us what the amendments do.
Mr. Chair, the amendments stipulate that the Administrative Process Act does not apply and that the Department's Office of Licensure and Certification will develop guidelines for the administration of the program. It also sets forth the process for developing those guidelines.
If there are no objections or questions, we'll adopt the amendments by consent. So adopted. Recommendation is to report and refer to appropriations. Discussion on the motion. Hearing none, record your vote on that motion. All members voted to care to be recorded.
Mr. Chairman, I vote aye.
The bill is reported and referred to appropriations 15-5. Delegate Walker.
Next bill is HB 1906 by Delegate Hope. The Auxiliary Grants Independent Community Living allows the Department of Aging and Rehabilitative Services to provide auxiliary grants to eligible recipients residing in independent living as defined in the bill. Under conditions set forth in the bill directs the Department of Medical Assistance Services to, if deemed necessary, amend the state plan for Medicaid assistance services and any waivers thereof to implement the provisions of the bill and the limits to be no more than 200, the number of auxiliary grant recipients in independent community living. The bill has delayed effective date of January 1, 2024, and directs the Commissioner on Aging and Rehabilitative Services to adopt the emergency regulations to implement the provisions. Mr. Chairman, that subcommittee recommends reporting with a substitute of 5-0, recommends referring to the Committee on Appropriations.
And staff, the substitute differences, please.
Mr. Chair, this removes some duplicative language in 51.5-160, which was duplicative of language in 51.5-160.1. And it also changes some of the language in 160.1 so that it applies to each local board of social services rather than local boards. It also removes the previous enactment clauses from the other version of the bill, and it replaces them with two other enactment clauses, the first of which states that the Commissioner for Aging and Rehabilitative Services will develop an implementation plan, and the second of which states that the provisions shall not become effective unless they are reenacted by the 2024 session of the General Assembly.
Questions on the amendments? If not, we'll adopt them by general consensus. The matter is now properly before us as a substitute with the recommendation to report and refer to appropriations. Questions on that motion? And please record your vote on the board on the motion to report and refer to appropriations. All members voted who care to be recorded. The bill is reported and referred on a vote of 17 to 2. Delegate Walker.
Next bill is HB 1917.
Bye for the day.
Bye for the day. All right. Next bill is HB 1969. Delegate Walker. The adult adoptee access to original birth certificate grants adoptees 18 years of age or older access to their original birth certificate. Mr. Chairman, the subcommittee recommends reporting with amendments 4-0.
And explain the difference with the amendments, please.
Mr. Chair, this amendment changes commissioner to state health commissioner for the purpose of specifying who provides access for adult adoptees to their birth certificates.
So purely technical. Without objection, we'll adopt that amendment. The recommendation was to report with amendment 4-0, and I believe I heard a second. If there's no discussion on that motion, please record your vote. Have all members voted who care to be recorded? The bill is reported on a vote of 18-1. Delegate Walker.
Next bill is HB 2033. Delegate Sewell. Audiology and language, speech language pathology interstate compact. Authorizes Virginia to become a signatory of Audiology and Speech Language Pathology Interstate Compact. The compact increases the public access to audiology and speech language pathology services by providing the mutual recognition of other members of state licenses for such services. The compact has been enacted in 23 states, and the Audiology Speech Language Pathology Compact Commission is currently preparing rules and bylaws in order for the members of the state to be fully integrated into the compact's data system. Mr. Chairman, that committee recommended 6-0 with the recommendations referring to the Committee on Appropriations.
Moved and properly seconded to report and refer 2033 to appropriations. Discussion on the motion. Hearing none, record your vote on the board to report and refer to appropriations. The bill is reported and referred to appropriations on a vote of 18-1. Delegate Walker.
Next bill is HB 2150. Delegate Ferris. This is I'm sorry.
2158.
2158, I apologize. Establishes Department of Medical Assistance Services abilities to transfer its rights of recovery on the third-party claims to managed care organizations. The bill specifies that the managed care organizations receive the same right to recovery as the department upon transfer of the claim, and gives managed care organizations a one-year period in which to identify and bill a third party, after which the department may pursue a claim. Mr. Chairman, that was recommended passage by 6-0 with a substitute.
And staff explained the substitute, which I think makes this now a Section 1 measure.
Mr. Chair, that's correct. This is now a Section 1 bill directing DMAS to evaluate its ability to comply with provisions of federal law.
If there are no questions about the substitute language, we'll adopt it by general consensus. It is properly adopted. And I would say to the chairman of the subcommittee, subsequent to our subcommittee meeting, we received communication that even in its current form, it should be referred to appropriations. So I would entertain a motion to report and refer to appropriations. Do I hear a second?
Second.
Moved properly seconded to report and refer 2158 as a substitute to appropriations. Discussion on the motion. If not, please record your vote. The measure is reported and referred to appropriations. Mark, do you care? You don't care. It's gone.
Next bill is HB 2211, Delegate Tran. Requires the applicants of licensure to practice licensure nursing who graduates in a nursing education program in a foreign country. Pass a written examination is required by the Board of Nursing, Second, passes language examination that assesses general English proficiency provided by an entity approved by the Board of Nursing. And third, submit the educational credentials for evaluation and verification by the entity approved by the Board of Nursing. The bill requires the Board of Nursing to identify at least 3 approved entities to provide language examinations and at least 3 approved entities to evaluate and verify credentials earned from a nursing education program in a foreign country, and to make the list of approved entities publicly available to the Board of Nursing. Mr. Chairman, that bill passed on a 6-0 with a substitute.
And staff, the differences,
So
please.
recommend.
Mr. Chair, the substitute lays out more specific requirements with regards to the credentials and the language examination for nurses who are licensed in a foreign country to be able to practice nursing in the Commonwealth. It also removes the enactment clause that required the Board of Nursing to seek public input in developing the list of approved entities.
If there are no questions or objections, we'll adopt the substitute by general consensus. It's properly adopted, and the recommendation to report as a substitute, 6-0. And I believe I heard a second. Questions on that motion? If not, please record your vote. Please close the roll. The bill is reported on a vote of 18-1. Delegate Walker.
Next bill is HB 2222, Delegate Hayes. All surgical technologists and surgical assistants who have successfully completed an accredited surgical technologist training program or surgical assistants training program to practice under certain conditions prior to certifications or licensure, respectively. The bill allows such persons to practice as a surgical technologist with the title of surgical technologist, certificate applicant, until it has been received a failing score or an examination for national certification, or 6 months from the date of program completion, whichever occurs sooner. The bill allows for such a person to practice as a surgical assistant with the title of surgical assistant license applicant until he has received a failing score on the national certification examination, or 6 months from the date of graduation, whichever occurs sooner. That bill was passed with a 6-0. Mr. Chairman, I so move.
Moved, properly seconded to report House Bill 2222. Questions? Please record your vote on the motion to report. Yeah, there you go. All members voted declare to be recorded. The bill is reported 19-0. Delegate Walker.
Next bill is HB 2224, Delegate Murphy. Provides that required newborn screening tests shall be performed at no cost to parents, guardians, hospitals, or healthcare providers. The bill prohibits the division of Consolidated Laboratory Services or any other laboratory the Department of Health has contracted with to provide such services from charging a fee to the hospitals or healthcare providers to perform the screening test, and prohibits hospitals and healthcare providers from charging a fee to an infant's parents or guardian to perform the screening services. Mr. Chairman, the subcommittee recommended passage of that with a recommendation, with a substitute and a recommendations to Committee on Appropriations, and I so move.
Please explain the sub.
Mr. Chair, this removes language that required an infant to be born outside of an institution in order to not incur a fee for newborn screening tests. It also makes it so that DCLS or any other laboratory that's contracted with the Department of Health to provide newborn screening services shall not charge a fee to hospitals and healthcare providers, and that hospitals and healthcare providers in turn shall not charge a fee to the infant's parent or guardian to perform screening tests. And it also removes the enactment clause requiring the Department of Health to create a standardized fee exemption form.
If there are no questions or objections to the substitute, it will be adopted by general consensus. Properly adopted, the recommendation is to report and refer to appropriations. I believe I heard a second to that motion. If there are no questions, Delegate Scott, do you have a question or a comment?
Yes, Mr. Chairman, just want to make sure I understand this correctly. We're telling individual laboratories that they must perform a service without being reimbursed for that service. Is that correct?
I could answer that for you, Mr. Chairman.
Delegate Ferris.
That's why it's going to appropriations.
Further questions? Motion is to report and refer. If there's no further discussion on that matter, please record your vote. All members voted to care to be recorded. The bill is reported and referred to appropriations on a vote of 13-6. Delegate Walker.
Next bill is HB 2315, Delegate Corey. This is directs the Department of Medical Assistance Services and the Department of Behavioral Health and Department of Services to convene a work group including responsibilities of community service boards, local Department of Social Services, the Department of Aging and Rehabilitative Services, the ARC of Virginia, the board, the Virginia Board of People with Disabilities, the Department of Education, the Board of Education, and other relevant stakeholders to study methods for the development, recommendations, and dissemination of information about intellectual development disability service. The Bureau requires the work group to report its findings and recommendations to the chair of the Senate Committee on Finance and Appropriations and Education and Health and the House Committees on Appropriations and Health, Welfare, and Institutions by October 1, 2023. And Mr. Chairman, that bill was recommended reporting with the 6-0. Also recommends referring to the Committee on Appropriations, and I so move.
Do I hear a second?
Second.
Moved properly seconded to report and refer 2315 to appropriations. Discussion on that motion? If not, please record your vote. Please close the roll. The bill is reported and referred to appropriations 17-1. Delegate Walker, I believe you have one more.
Okay, the last bill is HB 2489, Delegate LaRock. Requires the Department of Social Services to contact development and implementation of responsible fatherhood initiative for the purpose of providing an opportunity for every father in the Commonwealth to be able to obtain information and inspiration that would motivate and enable him to enhance his abilities as a father and establishes requirements for the entities contracting with the department to implement the initiative. Under the bill, each local board of social services shall undertake certain actions to ensure that the local Department of Social Services is addressing the unique needs of fathers of children served by the local department. The bill also establishes Fatherhood Support Grant Fund, which awards grants to not-for-profit, community-based organizations to address the needs of fathers. And, Mr. Chairman, that bill was recommended reporting on a 3-2. The committee recommends referring to the Committee on Appropriations, and I so move.
Do I hear a second?
Second.
Moved properly seconded that we would report and refer 2489 to appropriations. Discussion on the motion? Hearing none, record your vote on the board on that motion. All members voted to care to be recorded. The bill will be reported and referred to appropriations on a vote of 10-9. And I will say to the subcommittee chairman and all the members, thank you for your yeoman's work. And just for the record, if you notice, Subcommittee 3 had an extensive report of bills that came out this morning. So just y'all say they never do. Delegate Robinson, I believe we have your measure before full committee, House Bill 1681. As the patron comes forward, I would say that I put it on full committee because I'm not aware of any opposition to the measure. I believe there may be some amendments that need to be made, but that's why I think we can just take a little bit of the full committee's time and go ahead and get the measure out of here. Similar to the bill that went by for the day, my 1450, there's a Senate companion. The reason it went by is we think there may be some minor amendments that need to be made to that were made over in the Senate just to conform the two. Anything by way of announcement the committee needs to consider while the patron is coming forward? Delegate Robinson.
Thank you, Mr. Chairman, members of the committee. I was just confirming that we had several amendments that have been put into a substitute. So I have a
And knowing that
substitute
all
for this.
members have read all matters that come before this committee, if you could just tell us what the substitute does differently from the original that we all understand implicitly.
It just changes, it deletes some language that just didn't need to really be in there. It corrects a place where we had on line 60 of the original bill, institution, strike it, put in facility. Instead of skilled nursing facility, it has nursing home. They were just technical amendments.
That sounds somewhat akin to former Delegate Riley Ingram's explanation of a substitute he had that said it took some words out, it added some others, and moved others around.
And that's about what it does.
Questions about the proposed substitute? Do I hear a motion to adopt? Second? Without objection, we'll adopt that by general consensus. Delegate Robinson.
So, Mr. Chairman, this bill is really explained very well in the summary as it was introduced. And in light of time, I'm going to ask for the expert in this area to come forward because I think he can give you a much more condensed explanation to make it make sense than I could.
Mr. Chairman, Scott Johnson, on behalf of the Virginia Healthcare Association, the 5 amendments that were encapsulated in the substitute was from work with our good friends at DMAS, and appreciate all their work. I'm going to best explain this bill by a summary and tell you. The law today says if grandma is in the hospital and she needs to go to a nursing home, if grandma is on Medicaid, has applied for Medicaid, intends to apply for Medicaid, grandma has to be screened by the hospital screening team before coming to the nursing home. Today, if grandma arrives and after her admission to the nursing home realizes grandma should have been screened and was not, the law is silent on what happens, and we know 2 things happen. Grandma can't access her Medicaid benefits, and 2, the nursing home is forced to care for grandma and not be reimbursed. What this does is gives us a fix, or it fixes a void. It will say passage of this bill when grandma arrives at the nursing home and they realize, hey, she should have been screened and she was not. The nursing home screening team can screen her. DMAS will determine if benefits are appropriate. If so, grandma will be able to access her benefits and the nursing home will be able to be reimbursed for her care. In order to prevent any bad actors in this, if the nursing home had any responsibility in that screening not having been done at the hospital, they will have to wait 6 months before they're reimbursed by Medicaid. So that's what the bill does. I'm glad to answer any questions.
Any questions about this bill that's meant to take care of all of our grandmas? We have a motion properly seconded to report House Bill 1681 as a substitute.
See, I told you he'd do a quick job.
Hearing none, please record your vote on the board on the motion to report as a substitute. Vote for the grandmas.
I'm a yes.
You can record Delegate Robinson as yes. Any others care to vote? The bill is reported on a vote of 19-0. Committee members, that completes our docket for this morning. I will just add by kind of where we started off, we will have a subcommittee 3 meeting prior to full committee on Thursday. On Thursday, the intention is that the full committee will complete our work before crossover. Everybody's done an outstanding job with the number of bills that we've heard in subcommittee, and just commend everybody for your attendance and your actions. And if there are no other announcements, committee will rise.